Number 1. Antiarrhythmics. Antiarrhythmics are a class of medications used to treat abnormal heart rhythms or arrhythmias. These drugs work by either slowing down or stabilizing the electrical signals in the heart, helping to restore a normal heart rhythm. Arrhythmias can be categorized into various types, and antiarrhythmic medications are often classified into different classes based on their mechanisms of action. Here are some key points about antiarrhythmic drugs. Classes of antiarrhythmic medications. Class I, sodium channel blockers. These drugs primarily affect sodium channels in cardiac cells, slowing the rate of depolarization and conduction through the heart. 1. Class IA. Examples include quinidine, procainamide, and disopyramide. 2. Class IB. Examples include lidocaine and mexiletine. 3. Class IC. Examples include flecainide and propafenone. Class II, beta blockers. Beta blockers, as discussed in a previous response, are sometimes used as antiarrhythmics to slow heart rate and reduce the force of contractions. Examples include propranolol and metoprolol. Class III, potassium channel blockers. These drugs prolong the action potential duration and refractory period, helping to prevent certain types of arrhythmias. Examples include amiodarone, sotalol, and dofetilide. Class IV, calcium channel blockers. Calcium channel blockers, as previously discussed, are primarily used to treat conditions like hypertension and angina. However, some, like verapamil and diltiazem, have antiarrhythmic properties and can slow the heart rate and reduce conduction through the atrioventricular (AV) node. Class V. This class includes other miscellaneous antiarrhythmic drugs, such as adenosine, which can be used to treat certain types of arrhythmias. Indications. 1. Antiarrhythmics are used to manage various types of arrhythmias, including atrial fibrillation, atrial flutter, ventricular tachycardia, and supraventricular tachycardia, among others. 2. They may also prevent arrhythmias in individuals at risk, such as those with a history of recurrent arrhythmias or certain heart conditions. Side effects and considerations. 1. The choice of antiarrhythmic medication depends on the specific type of arrhythmia, the patient's overall health, and potential side effects. These medications can have proarrhythmic effects, meaning they may worsen arrhythmias in some cases. 2. Monitoring is essential. Regular follow-up with a healthcare provider is necessary to adjust the dosage and monitor for any adverse effects. 3. Antiarrhythmic drugs can have significant interactions with other medications, so it's crucial to inform your healthcare provider about all your medicines. Number 2. Anticholinergic drugs. Anticholinergic drugs are a class of medications that block the effects of acetylcholine, a neurotransmitter in the central and peripheral nervous systems. Example, atropine. Acetylcholine plays a role in various bodily functions, including muscle contractions, nerve signaling, and regulation of bodily secretions. By blocking acetylcholine, anticholinergic drugs can have a range of effects on the body. Here are some key points about anticholinergic drugs. Mechanism of action. Anticholinergic drugs work by inhibiting the binding of acetylcholine to its receptors, specifically muscarinic receptors. This leads to a decrease in the effects of acetylcholine in various tissues and organs. Atropine is a medication that belongs to the class of drugs known as anticholinergics or antimuscarinics. It is derived from the belladonna plant and has a variety of medical applications due to its ability to block the effects of acetylcholine, a neurotransmitter that plays a role in various bodily functions. Here are some key points about atropine. Mechanism of action. Atropine works by blocking the effects of acetylcholine at its receptors, specifically muscarinic receptors. This leads to a decrease in the parasympathetic nervous system's activity, which is responsible for functions like slowing the heart rate, constricting pupils, and promoting gastrointestinal activity. Indications. 1. Bradycardia. 2. Pupillary dilation. 3. Antispasmodic. 4. Nerve agent poisoning. Side effects. 1. Common side effects of atropine can include dry mouth, dry eyes, blurred vision, constipation, and urinary retention. 2. It can also cause an increased heart rate, which may be a desired effect in certain situations but can be problematic if overused. Contraindications and precautions. 1. Atropine should be used with caution in individuals with certain medical conditions, such as glaucoma, gastrointestinal obstructions, and urinary retention. 2. It may interact with other medications, so it should be administered under the guidance of a healthcare professional who can monitor for potential drug interactions and side effects. Number 3. Critical care medications. Critical care medications for cardiovascular emergencies are used in intensive care units, ICUs, and critical care settings to manage life-threatening cardiac conditions. These medications are administered under close monitoring by healthcare professionals to stabilize and improve the patient's cardiac function. Here are some critical care medications for cardiovascular emergencies and their common indications. 1. Vasopressors. Vasopressors are a class of medications used in critical care and emergency medicine to increase blood pressure and maintain organ perfusion in patients with severe hypotension, shock, or other life-threatening conditions. These drugs work by constricting blood vessels, which raises blood pressure and improves blood flow to vital organs. Vasopressors are typically administered intravenously and require close monitoring due to their potent effects. Here are some key points about vasopressors. Common vasopressors. Norepinephrine. Norepinephrine is one of the most commonly used vasopressors. It acts on both alpha-1 and beta-1 adrenergic receptors, leading to vasoconstriction and increased cardiac contractility. It is often the first-line choice for septic shock. Epinephrine. Epinephrine is a potent vasopressor and inotrope. It stimulates alpha-1, beta-1, and beta-2 adrenergic receptors, leading to vasoconstriction, increased heart rate, and improved cardiac output. It is used in cardiac arrest, anaphylaxis, and severe hypotension. Dopamine. Dopamine is a vasopressor that can have varying effects depending on the dose administered. At low doses, it primarily stimulates dopaminergic receptors, leading to renal vasodilation and increased urine output. At higher doses, it acts on beta-1 adrenergic receptors to increase cardiac contractility and alpha-1 receptors to cause vasoconstriction. Indications. Vasopressors are indicated in cases of severe hypotension, shock, such as septic shock, cardiogenic shock, or hemorrhagic shock, and other conditions where maintaining adequate blood pressure and organ perfusion is crucial. Mechanism of action. 1. Vasopressors work by constricting blood vessels, which increases systemic vascular resistance, SVR, and raises blood pressure. 2. In addition to vasoconstriction, some vasopressors may also have inotropic effects, enhancing the heart's contractility. Administration and monitoring. 1. Vasopressors are administered intravenously through a central line or a large bore peripheral line. 2. Continuous monitoring of blood pressure, heart rate, central venous pressure, CVP, and oxygen saturation is essential. 3. Titration of vasopressor dosages is based on the patient's hemodynamic parameters and response to treatment. Potential complications and considerations. 1. Vasopressors should be used cautiously and under the guidance of a healthcare provider, as they can have significant cardiovascular and systemic effects. 2. Overuse or excessive doses of vasopressors can lead to tissue ischemia, arrhythmias, and increased myocardial oxygen demand. 3. Inadequate tissue perfusion despite vasopressor administration may require additional interventions, such as fluid resuscitation or inotropic agents. 2. Inotropes. Inotropes are a class of medications that affect the contractility of the heart muscle, myocardium. They are used to increase the force of cardiac contractions, improve cardiac output, and support the heart's pumping function, especially in cases of heart failure or other conditions where the heart's ability to pump blood is compromised. Inotropes work by altering the balance of calcium ions inside the cardiac muscle cells, leading to increased contractile force. Here are some key points about inotropes. Common inotropes. Dobutamine. Dobutamine is a synthetic catecholamine that primarily stimulates beta-1 adrenergic receptors in the heart. It increases cardiac contractility and heart rate, making it useful in the management of acute heart failure and low cardiac output states. Milrinone. Milrinone is a phosphodiesterase 3 inhibitor that increases intracellular cyclic adenosine monophosphate, CAMP, leading to enhanced cardiac contractility and vasodilation. It is used in acute and chronic heart failure. Indications. Inotropes are indicated in situations where the heart's contractile function is compromised, leading to reduced cardiac output. Common indications include acute decompensated heart failure, cardiogenic shock, and low cardiac output syndrome. Mechanism of action. Inotropes work by increasing the concentration of calcium ions inside cardiac muscle cells. This leads to stronger contractions of the heart muscle, improving the heart's ability to pump blood. Administration. Inotropes are typically administered intravenously in critical care settings, allowing for precise control of dosage and rapid onset of action. The dosage and infusion rate are carefully titrated based on the patient's hemodynamic parameters, such as blood pressure, heart rate, and cardiac output. Monitoring and considerations. 1. Patients receiving inotropes require continuous monitoring of vital signs, including blood pressure, heart rate, and oxygen saturation. 2. Hemodynamic parameters, such as central venous pressure, CVP, and pulmonary artery pressure, if available, are monitored to assess the response to treatment. 3. Electrolyte imbalances, particularly potassium, should be corrected, as they can affect the heart's response to inotropes. 4. The use of inotropes should be guided by a healthcare provider with expertise in critical care and cardiology.